right, class, welcome. So I'm going to talk about a drug here that I think actually is kind of underutilized in emergency medicine. And so, with that being said, let's get into it. And it's magnesium sulfate. I think that we way underuse this. It's got some really great uses to it. A couple years ago, it was thought to be the drug that was going to do some revolutionary things. It didn't happen. I've got my own little theories about that. But I'm going to tell you what it does do and tell you why I am such a fan of this guy. So it's, again, magnesium sulfate. It's used to control magnesium, and it's used in pediatric acute nephritis. Again, so they got kidney issues there with those. It's helped to prevent seizures for the preeclamptic, eclamptic, or toxemia pregnancy patients, okay? And the other use is to be used in life-threatening arrhythmias such as polymorphic V-tach, otherwise known as torsades. Remember we talked about magnesium kind of the bully. It kind of holds everything up. But that's why it's actually so good, is that it slows down everything. And so, it definitely relaxes smooth muscle. And we're talking about some other different treatments in here. It's very important to understand that, okay? So, again, the class of drug, it's an electrolyte, it's a CNS depressant. A tocolytic, it actually will stop uterine contraction. It relaxes smooth muscles. That's why we like it. So, again, it is a calcium channel blocker, and then it blocks the neurological transmission. Remember we were talking about with the fundamental physiology stuff? If you've watched those videos, he's the guy that beats up the freshman. He was the guy that slows it up so sodium can't get into the cell. And so because of that, again, it slows everything, and it's a smooth muscle relaxant, which is why we like it so much. And again, you can replace if you got cardiac arrhythmias due to low magnesium levels, of course, it's obviously the drug for you. And again, it reduces the incidence of post-infarction ventricular arrhythmias, which is actually why I've seen it work and work very well. We used it a lot over in Putnam when I was there, and I will tell you that it was kind of like a mainstay drug for us during the cardiac arrest, and it was kind of surprising how well it worked. And the reason that got kind of killed was because in 2015, the AHA came out and said, well, it really doesn't do anything. And it was based on one or two papers, and I was like, wow, this is kind of interesting. But I can tell you, I've used it a lot. It works, and it works very good. It does a lot of vasodilation as well. So for that patient that's having a hard time breathing, this is actually kind of a good one. It does uterine relaxation, okay? Because, again, and it's used as a bronchodilator. Again, smooth muscle relaxant. It relaxes all that smooth muscle, opens it up. It doesn't as tight as it used to be. And it inhibits acetylcholine release, and therefore the motor nerve terminals, it slows them down a little bit. All right? So usually this onset's almost immediate. It's less than 1 minute when it does onset, and it usually lasts for about 3 to 4 hours. So what we do use it for is to correct torsades, or polymorphic V-tach. If the patient is having an eclamptic seizure, this is our drug of choice to go to probably before we go to the Versed or Ativan to stop the seizure activity. This is like very close behind it second. If they suspect that the patient's magnesium is low, chronic alcoholism, wasted away, they use a lot of diuretics that can be depleted, we can replace the magnesium. It can be used for refractory VFib. That is out of the ACLS algorithm, but again, I've seen it work, so I know that it does have some good effects that way. And it can cause bronchodilation, and anticholinergics have been used. I will tell you guys, a quick way to turn around a really tight COPD is to hang a bag of mag, 1 gram, give it over about 15 minutes, and it's amazing how quick these folks open up, okay? Again, it's going to cause you to get sleepy. You're going to lose some deep tendon reflexes. That's kind of normal. Matter of fact, when you start tapping on their knees, just below the knee there, their knee won't jump anymore. Again, it can cause some arrhythmias, though, and it can definitely cause bradycardia. So that is usually the kind of the bad point about that. If they're bradycardic, stay away from it. it can drop your pressures as well. And again, it can cause a little bit of itching again, and it's usually because you gave it too fast. If they are having any type of heart blocks, stay away from this drug, okay? So they got bundle branch blocks. Be careful with that as well. You really need to be careful when you're dealing with any type of heart block. If their calcium is low, by the way, remember he kind of bullies the calcium, and so then sodium's definitely not getting in the cell, and because of that, again, you definitely want to stay away from it. Matter of fact, when we give too much MAG, our antidote is a push of calcium gluconate. Or calcium chloride, it depends on what you have, preferably calcium gluconate. If they have a toxemia pregnancy, if delivery is imminent, don't worry about pushing it, because newsflash, the baby's coming no matter what, and therefore it's not going to really help. If they have heart damage or respiratory depression, you got to really be careful again, because that is one of the major side effects of MAG, is that it can cause respiratory depression. All right, so again, if the reversing is calcium glucate, 5 to 10 milliequivalents per kilogram. You can use calcium chloride. You probably shouldn't. It really burns up your veins when you use that. And make sure if you do use that, even calcium gluconate, push it real slow. And then you can have the cardiac changes can occur because of the glycosides, and it's antagonized by any type of calcium product. So make sure, by the way, don't get both in the same line. Flush it very well. Make sure that you're not using any MAG. It forms the nice, lovely crystals. All right. So again, this is one of those drugs, just like calcium, just like potassium, just like sodium. If you've got the patient on this, you should probably have them on a cardiac. You need to have them on a cardiac monitor. Again, use it in caution with decreased renal function. That's how they get rid of it. Guys, be careful with that renal function thing. If they're not peeing or they're on dialysis, definitely stay away from MAG. Okay. Again, your rapid administration can cause a respiratory or cardiac arrest. Remember when I said I would put 1 gram, put it into a 100 cc bag, and run it in over 15 minutes? There's a reason why. Nice and slow getting in is a good thing. And again, your overdosing can cause respiratory distress, or it can cause heart blocks. If you're starting to see a significant lengthening of the PR interval or QT interval, it's probably time to shut the MAG off, okay? Again, have your calcium gluconate, have it there as an antidote. If you see them getting flush, sweating, hypotension, they start getting paralysis, you start seeing depression, cardiac function, guys, stop it, okay? Especially the flu, they'll get actually red on you. They'll get really red. They'll start to sweat. If you're starting to see that, back off. Don't shut down your MAG for a little bit. And probably you've got plenty in there by now. So again, just shut it off. And again, the cure for toxemia, any type of toxemia for a pregnant patient, the cure is to have the baby. So if you're using MAG on that, is so long and the short, you don't want to do that. By the way, convulsions can occur if you get the patient to start seizing on you because you gave them too much MAG. You're looking at about 48 hours after delivery if they're doing that with the toxemia. So you might need to have a continual infusion of that. Definitely call your doc, get the orders for that. Like I said, you're going to have to get an order for that. And when I was talking about that, we're talking about when the convulsions, that's due to the pregnancy patient. These guys, again, they're going to seize a lot on you. And again, once the cure to it again is get the baby out. So Torsades, we usually give 1 to 2 grams mixed in 100, and we give it over 5 to 20 minutes. I would say probably more the 5 minutes because we don't want to leave them in Torsades. If they've got a pulse and MI with hypomagnesia, 1 to 2 grams over 5 to 60 minutes. Again, give it slow, especially if they're tolerating it. If they're not tolerating it, then we're going to probably cardio or defibrillate these patients because they're in Torsades. So again, but start administering this, give it time to be administered. If you're having a seizure, again, 1 to 4 grams over 3 minutes, followed by an infusion of 1 to 2 grams per hour. We usually put a 2 grams in a 100 bag, and then just set the drip rate to where it runs in over an hour's time. Usually we give an asthmatic, we usually give them 20 to 50 milligrams per kilogram. Usually it's a 2 gram dose, 1 to 2 grams is what we use. And again, remember I said I give it over to 15 minutes? Well, over 10 to 20 minutes is the recommended dose. Kids, stay away. Don't give it to the kids unless the doctor says for specifically to do it. All right, so here's again some little things that if you can give 400, and if you set your drip rates there, again this is simple the math, but this is kind of shortened out for you. Again, magnesium sulfate is used to treat pregnancy patients. So it is again recommended that the drug not be administered in the 2 hours prior to delivery, if at all possible. Remember that it slows down the delivery process. All right, that's going to do it for MAG. Like I said, I'm a big fan of it, especially with the difficulty breathing patients. You'll be surprised how it will turn a really bad asthmatic around. So be thinking that in the back of your mind. You know what? I'm giving albuterol and Atrovent. Man, this stuff is just not working. The CPAP's really not working. But, what else can I use? Can I use epinephrine? Absolutely. But can I also use MAG to help relieve those symptoms? It works, guys. I'm just going to say it like that. It works. All right, I'll see you on the next one.